Thank you for your interest in our clinical education program for the Masters of Science in Speech-Language Pathology. My name is Robin Samlin, and I am the Associate Department Head for Clinical Education. We have two primary goals for our clinical education. The first is for our students to learn how to use the knowledge of communication sciences and disorders in order to help individual clients achieve their communication goals. And our second goal is for our students to achieve independence in assessment and treatment of communication disorders across the lifespan. Our clinical education program has three components that work together. The first is the classroom. The second is our University of Arizona Department Clinic, and the third is our off-site rotations. Our classroom is really key to the place where we integrate a lot of the information we need in order to do well in clinic. We learn in the classroom about disorders, about assessment, treatment, about putting the information together in cases, and sometimes we even bring in standardized patients or simulations. The University of Arizona Department Clinic I'll talk about in a moment, but both of those start the first semester of the program, so that students are really getting both pieces. And our off-site clinical rotations begin during the summer or the second year of the program. During the first year, our students begin clinic the first semester with a University of Arizona clinical faculty member. And then during the summer, they'll either be with one of our UA clinical faculty or somebody in the community. And during the second year, we spend a lot of time on off-site rotations, so you get more variety. And this matches with our clinical development journey. We start with a lot of support, so you're not thrown into a room your first day with a client by yourself. And we're moving towards increasing independence across settings, across disorders, across ages. Our clinic really is a full-time program, so that students have the time they need to develop as a clinician, as a speech-language pathologist. So during the school year, when students are not in classes, they're usually either in clinic or should be available for clinic, and that's Monday through Friday from about 8 to 5:30. During the summer, our placements are full-time, so we expect students to be available for a 13-week rotation that can either be one placement or two different placements, but really 12 to 13 weeks of full-time work. And I want to acknowledge that makes it hard to work in the program, and that's important for a lot of students. So if you have a job that has evening and weekend hours, you're much more likely to be able to get the clinical hours you need and have the variety of placements that you're looking for. Our first year, as I said, is with University of Arizona faculty, and our circled building there is the Speech and Hearing Department. This is the entrance to our on-campus clinics. And our on-campus clinics serve a variety of ages and a variety of communication needs. And our students will have different experiences, but gain interest with children, with adults, with developmental and adult language problems or concerns. They'll get work in literacy, speech sound disorders with neurodiverse populations. They'll learn hands-on about fluency, working with children who are deaf and hard of hearing, augmentative alternative communication systems, and then motor speech, voice disorders, dysphagia. And I want to point out that Tucson is a multicultural and a multilingual city, and many of our placements give students opportunities to learn about cultures and languages other than their own. Not all of our first-year experiences are on campus, even if they are with our clinical faculty. Some of our faculty work at Wings on Words Preschool. They take students with them to the Rio Rico schools, which is about a 45-minute drive. and an amazing opportunity. We work with students at the City Center for Collaborative Learning in Tucson. We provide outpatient telepractice services to Benson Hospital for both children and adults. And we have a lot more opportunities that I'll look forward to you learning about. The common denominator of that first semester clinic is that students have a lot of support from the faculty. So we're expecting help in planning and conducting sessions and really figuring out who the student is as a speech-language pathologist. And the faculty will help with students to learn and grow as they develop. That support continues during the summer and the second year. So you might be asking at this point, how do you know what I want to do? I do ask. I have a clinical interest survey that goes out during all semesters other than the first semester and last semester. And this interest survey lets you tell me what you want to do long term, what experiences you'd like to have in terms of ages, settings, types of disorders, or communication needs that interest you. And I do my very best to keep placements on the list of things people do want and not on the list of things they don't want. Our summer is an opportunity for this deep dive into a setting. Sometimes that's on campus, sometimes that's off campus in Tucson. We have a lot of placement opportunities in Phoenix, particularly medical settings and private practice settings. And then we have a lot of students who choose to leave town for the summer, perhaps escaping our heat, or perhaps looking for a placement opportunity in a community where they hope to live after graduation. Our off-campus sites in the Tucson area are varied. We have several school districts that are so gracious in hosting our students every year or many years. There are several private practices, including private practices that focus on feeding and infants and early intervention. We have a lot of clinical research opportunities here, and we have medical settings for both adults and children, although children primarily outpatient. So that's an overview of our clinic. I look forward to fielding questions from you, and please check us out and think about our program. Thanks for your attention.